Hello, welcome to Kunia Health. Here is your host and regular anchor on this program, Zion the Expressionist. Today's question is, why do some women have swollen legs and sometimes swollen arms when they are pregnant? Yay! You are excited to hear that? Okay, let's talk about that. Some women do have it, not all women. And this happens at a specific time. During the third trimester, that means when the baby is almost getting ready to be delivered. Yes, this is because of the size of the baby. Because of the size of the baby, meaning that the woman is now double. And every activity the woman is having has increased. That means there is what we call the increased metabolic activities in the woman's body. Yes, the woman has increased metabolic demands, and that means that there is a lot of changes which is called hemodynamic changes or hemodynamic uteroplacental circulation. Simply that the blood has changed in a lot of ways in terms of movement, volume, and that of the child. How? From research and studies, it has shown that within this time, the body of the woman has changed to the extent that it has added pressure to the heart because of increased volume that has increased up to 30%. Yes, this blood has to circulate and equally go down to passing nutrients to the child. At this time, there is equally hormonal changes. At this time, there are a lot of things that makes this add pressure to the heart and the entire woman's body. And so, this is why the blood of this woman will have increased volume. Another thing that also happens that you will need to know, though it's a very jargonistic word, is that there is activation of the renin-angiotensin system. At this level, it means that the blood flow would increase in terms of its pressure. However, there is equally a compensatory increase in the maternal plasma arterial natriuretic cycle, or rather peptide. This actually helps in the body in terms of retention of sodium and water. With this balance, the woman's body has a way of retention depending on how much the body vessel has adopted. That is why this happens mostly to women who are giving birth for the first time. Sometimes their body adapts these changes and they wouldn't be able to have this kind of retention. Another thing you will need to know is that when this kind of swollen or edema is happening, when it comes to the face, that's a different thing. You need to take this woman to the hospital. It is no more what we are talking about, because the fluid retention often goes down from the heart down to the lower extremities. When it's showing on the feet area or upper area, there is need to check if the woman is having sign that shows that she might be going towards preeclampsia. Yes, which is a very bad condition due to high blood pressure. Now I see there is an interconnection between high blood pressure and pregnancy, because there is increased demand and increased flow of fluid as well as blood. So within that time, the woman's blood pressure changes, and that means that there is need to be monitoring woman's blood pressure when she is pregnant. There is more blood, thus there is more pumping of the blood in the heart. The heart rate also changes and there is risk for different heart problems. Monitoring is the key. And as well, this woman needs to do something to ensure that this blood, or rather this fluid down there from the plasma, is not accumulating. The edema reduces. How would she do this? Simply exercise. Back to what we are talking about. With exercise, the woman will be able to allow better circulation that will help in releasing this by urinating and voiding in different ways. Of course, we know that that actually happens during pregnancy, but we're talking about all the fluid that is accumulating there to be leaving the body instead of taking medications that will take you that out. You should not be standing at a place for a long time. Sedentary should be avoided. The woman sometimes will have to sit inside water and do some leg exercise. Exercise matters a lot during pregnancy. Such is the reason why you see some women, even when they exercise, they are doing lifting and a whole lot of other things that even increase the demand of to their heart and every other part of their body. But exercise is generally something that is always very healthy for a pregnant woman. Just watch the video you see on the screen of a woman who does this kind of exercise, you see. Or any time with the 4 kids she has had, that's how she has been doing her exercises. And that's how proven from research that it doesn't hurt. But that's not my advice to you anyway. My advice to you is that you exercise every day of your life, at least 30 minutes, even when you are pregnant. Walk is a very good exercise for a pregnant mother too. Likewise, any other exercise that you choose your body can tolerate. Stretch always, sit and stand, stretch. Do not sit at a place for a long time and do not stand at a place for a long time. Regular exercise helps. However, mind the kind of environment you stay. If it is hot weather, please always try to avoid it because it causes what is known as vasodilation or venodilation and makes the veins to equally become very much enlarged to kick off in terms of allowing bigger volume of blood in your vein and arteries. So at this point, I would want to end this, but remind you that what you eat as well within that period matters, because that is the period when hypertension increases and a whole lot of other heart diseases might be waiting by the corner. So that you give birth to this child very peacefully, there is need for you to do all these, take all these precautions and have a very healthy life. Of course, that's all we discuss here. Your health is our concern. Welcome and have a wonderful day.